Hello, this is Dr. Michael French, pastor of New St. Mark Church of God in Christ in Indianapolis, Indiana. I'd like to discuss with you the importance of heart disease. Do you know that heart disease is the #1 cause of death in the United States? Approximately 1 million people will suffer from heart disease each year. About one person will die every 30 seconds of heart disease, which figures to be about 2,600 deaths per day. It is important to recognize the symptoms of heart disease. If you have sudden chest pain, chest discomfort with radiation into the arm, left arm, or up into your neck, if you develop shortness of breath, nausea, sweating, dizziness, these could be symptoms of a heart attack. A heart attack is a medical emergency. That's where enough blood flow is not getting to your heart muscle. Emergency treatment is necessary to prevent further damage and possibly death. There are a number of medications available today that can be used for treatment, but time is of the essence. You can work with your doctor in identifying the risk factors for heart disease. If you smoke cigarettes, if you're a man, if you are over the age of 55, if you have high blood pressure, diabetes, or cholesterol, you may be at risk for a heart attack. Prompt recognition of these risk factors, changes in your diet, an exercise program will offer you the possibility of reducing your risk of heart disease. Once again, this is Dr. Michael French, and this is a Health Minute. This is Dr. Michael French, pastor of New St. Mark Church of God in Christ in Indianapolis, Indiana. I'd like to discuss with you the importance of recognition of diabetes. Do you know that diabetes is the 7th leading cause of death in the United States? Last year in 2007, 24.7 million people suffered from diabetes. This represented an increase in 3 million over the last 2 years. Diabetes has two major categories. Type 1 diabetes, also known as insulin-dependent diabetes, has also been called juvenile diabetes because it often affects young people. Type 2 diabetes is known as non-insulin dependent diabetes and usually occurs in people after the age of 40. Do you know the symptoms of diabetes? If you have an increase in thirst, frequent urination, weight loss, increase in appetite, nausea, sometimes blurred vision, these may be symptoms of early onset of diabetes. Prompt recognition and early treatment can prevent complications of diabetes. Diabetes can affect your eyes, your heart, your nervous system, your GI system, your skin, and almost every organ system in your body. There are important oral agents that are available, and there are many types of insulin that are available. But when you work with your doctor, they may be able to lower your blood sugar with just a change in your lifestyle. If your fasting blood sugar is greater than 110, the doctor may order a test known as a hemoglobin A1C. That should be less than 6. If you can work with your physician, you may have a greater chance of avoiding the complications of diabetes and look forward to your future. This is Dr. French again, and this is a Health Minute.